When you mention to someone about psoriasis, they will all run away because they don't know whether it's true. You are saying it's not contagious and it may be contagious. My name is Nyawira Munyiri. I'm 32 years. I've lived with psoriasis for more than 20 years. Psoriasis has covered like 90% of my body. Psoriasis started as a small pimple. It started on my leg. All of a sudden now it was all over my body. My skin was very itchy. There were scales and all those from my body. Anywhere I would sit, they would peel off. It has been a journey where you are affected emotionally, mentally, physically, because actually skin is on top where everyone can see. I had to cover my skin. I had to wear long skirts. I had to wear long sleeves.
Psoriasis is a relatively common condition. It affects 1 to 2% of the world's population. It doesn't matter what gender you are, it affects males and females equally. However, it has been shown to be distributed amongst two populations, and we're looking at age groups. So about 16 to 22, so late teenage years, and then it can resurface again sort of 57 to 60 years old. Psoriasis is known to be genetically inherited. So about 1 in 3 patients will have a first-degree relative that had psoriasis. It's a chronic condition, which means it's got a long-standing clinical course. It's not contagious. It's not an infectious condition. It's not because the patient hasn't showered or is filthy. They have a problem with their immune system, where they're basically shedding more skin than the average person is shedding. These patients are having to live with red inflamed skin that's really scaly, and so they can appear like they've got dandruff all over their skin, all over their clothes as well. And so all of this results in a lot of anxiety, a lot of depression. Some people even have suicidal ideation.
My wish is that everyone will never go through what I went through. Sometimes you would feel discriminated, so you'd feel like you're not even free to go to people, near people. So sometimes you go even to hospital, they need to take your blood, and then they say your skin is different, and then the nurses would even try to tell you, oh, this is HIV or this is a different condition. You say, what is this? And then they feel like they treat you like you are going to make them get the condition also.
We're very lucky because thanks to all the research that has gone into psoriasis, we have come up with different treatment modalities that are all geared to clear the skin. And that is what a lot of people would refer to as remission. So we have put people on therapies that have cleared the skin. We've kept them on the therapy for a little longer after the skin is cleared, and then stopped the treatment, and the psoriasis has remained in remission. Obviously, we follow up those patients for a little longer because with psoriasis, the management options involve a lot of psychotherapy, a lot of social support, psychological support throughout their journey with this disorder.
Having a family support from my sisters and my brothers and my parents, they would show me love. They would ensure I'm taking my education, even at my lower moments. Like my sister, she has really worked with me. I think it is a bit emotional because my sister, she loves me. Yeah. She loves me, she encourages me, and I feel I have shoulders to lean on with my family.
Even to date, we keep encouraging her, because I'm actually so happy when I see her not hiding it anymore. So she would be so covered up even when it is very hot. But today she is an ambassador of psoriasis in Kenya, so I'm very proud of her.
I manage psoriasis by avoiding stress, since I have already known that stress triggers psoriasis so much on me. I avoid alcohol. Sometimes I check on what I'm feeding on, because sometimes I would feed on something and then I feel like it has reacted on me, and once it reacts, of course, If something reacts, even if it's an allergy, it will come out as a psoriasis for me. I manage also through ointments, different ointments. Sometimes it just disappears without even managing it. You can only manage it once you understand what you're suffering about, and you accept that this is a condition that you're going to live with. Sometimes God doesn't give us a condition that you will not be able to carry on. Fight on, be strong, and don't mind what the society is defining you. I'm a mother of one, and she doesn't have psoriasis. They're not scared of what I'm going through.